Hello, dear students. Imagine a situation which you are going to face in the near future where you have slogged for one full year and now is the time to give the examination. Suddenly in the morning, you are all stressed out, you are feverish, and you cannot attend the exam. Do you want to be in this situation? Never. But don't worry, every student faces this sort of anxiety and stress before the exam. The stress can be healthy or unhealthy. Now let us see in this video how to prepare yourself to give a good examination. I'm going to tell you this through three simple steps. The first step is the preparation. The second one is the presentation. And the third is performance. So what is preparation? Preparation is the phase which is a continuous process the whole year through. Whatever you are doing, that is preparation. What is the final preparation before the exams? Now, this will be different for theory and different for practicals. So, theory preparation will be as per the notes or your questions you have to prepare. But the practical preparation, especially for the first MBBS, it is something different. You should study the bones, you should know the muscle attachments, you should know your slides, you should know your embryology models. So there are different types or different subheadings which you need to prepare. This is about the preparation. Okay, you are prepared well. You have to do that. This is the very, very important phase before giving the examination. A person who is well prepared will feel confident. Okay, so when you are prepared fully for your examination, what is the second step? It is the presentation. Now, this we will see under two headings. The first one is the personal presentation. What is it? It is how you present yourself. Now, this will be both your physical appearance and your mental presentation. In physical appearance, always remember, may it be for theory or the practical examination, make sure that you sleep well, you get up early, you are well dressed, you are presentable, you eat something, and you come for the examination. May it be for theory or practical. I have seen some students, they just get up from the bed as it is they have been awake for the whole night and they come in the exam hall. This is not the proper way. For practical Viva voce, since you are going to give this Viva voce for the first time in your life, you have to be presentable. Your hair should be tidy, your nails should be tidy, you should have a clean apron, and you should be presentable. The second type of presentation is the presentation of your answers. Now, in theory exam, when you're writing, you have to present your answers in a proper format, which may be your own format or the textbook format. You have to draw neat and label diagrams wherever necessary. You have to strictly follow the timings. Suppose there is a long answer question for 8 to 10 marks, you must finish it within 20 minutes. If you cannot, you leave some space for that answer and go to the next question. Unless and until you attempt all the questions, you will not have a good or a high possibility of passing. Remember this. The third tip or the third important aspect is your performance. Now, what is this performance? Suppose I have gone for a Viva and the examiner asks me certain questions, like 10 questions, and I come out and say, oh, I answered all the questions and my Viva was excellent. This is what the students feel or say when they come out of the exam. Now, I'll give you an example. Suppose I am taking the Viva and I ask the student about the scapula. I ask, can you name the joint formed by this bone? The student says, yes, shoulder. I will ask further, can you classify this joint? Yes, ma'am. It is ball and socket. Okay. Is it a multiaxial? Is it a synovial joint? So the student will then say, yes, it is a synovial, it is a multiaxial joint. Now, these are the three questions, but actually, it has to be answered in a single question. Like, the joint formed is a ball and socket variety of synovial multiaxial joint, which is also called as the shoulder joint. This is a single answer. So, when the student feels that he has answered three questions, actually it is a single question or a single answer. Now, when you answer in this format, the examiner understands your level of knowledge and you have a better chance of scoring well. So, in this way, you can evaluate your own performance. Another important tip is when you are waiting there for your turn to come, never ever ask your colleagues, what is the examiner asking? We have seen many a times, because you have that bias in your mind, we have seen students coming when we give them femur, they say that it is humerus, just because the previous student had told this student that the examiner is asking about humerus. So though he is seeing the femur, in his mind he knows that it is femur, he fumbles over there and tells that it is humerus. So these are few tips that you should remember and which will take your examination to a next level. It will make you comfortable, it will make you confident, and you will give an examination which would be self satisfying and self rewarding. Wish you all the success in your first MBBS exam and all the exams in your MBBS career.